Shirley Marshall Davis, who will also be presenting. And I'm in two capacities. So Mrs. Shirley Marshall Davis is the chairperson of our governance committee of Sigma Kappa, of Omega Kappa, chapter of Sigma. I am the counselor of Omega Kappa, chapter of Sigma. And so we are doing this series now to basically, refresh some persons and speak about professionalism in nursing and in the workplace. Mrs. Marshall Davis.
Good morning, everyone. Can see. I'll turn on the. Okay, good morning, everyone. Thank you for joining. Indeed, it is a pleasure to be here to share with each and every one of us. And I pray that this will be a very productive day. Can you hear me?
Yes, we can hear you. And I'm reminding everyone, please, when you're joining, please join with your names, your full names. I'm seeing somebody in the chat, in the participants with a phone name. So please join with your full names, please. And if you've been allowed into the room without your full name, could you change it to your full name, please? And right, and continuing education hours will be given based on attendance. We'll be sending you a link in the chat for you to do your registration, and we'll be using that in order to create the certificates for your attendance. All right, so you don't need to put in the chat for the hours. We'll be sending you a link. Okay. So I'm just letting persons in. Mrs. Marshall Davis, 1 second, please. I'd also like to welcome our Bellevue Hospital nurses. And all other nurses that have joined to be a part of this presentation. I'm going to also ask that everyone please keep your mic muted unless you'd like to ask a question. Now we'll have a question and answer portion at the end of the presentation, so you'll be able to ask your questions. I'm just asking for those of us like myself who are up in age for you to write down your questions so you don't forget them, and you can ask them at the appropriate portion so that we have a nice flow. There is a raise hand feature, and so you can raise your hand at that time to be so acknowledged. Thank you. Please remember, keep your mics closed unless you're speaking to the group, because it can be very distracting. All right, this morning's presentation, as you can see, is on professionalism and professionals and application to practice. It will be a refresher as to different practices that we expect in the workplace, and it can help you wherever you choose to work in this world, because while certain practices might be different, professionalism is standard. And so we're going to get straight into it now. It is now 10 minutes past 10. And in Sigma, we don't do late. So we apologies again for the technical difficulties. and we're going to begin right now. Mrs. Marshall Davis, can you flip through the slide, please? Just to reiterate, there are persons trying to join, not using their full names, and that's why they're still in the waiting room. So if anyone is asking, saying that they can't get into the waiting room, please just let your colleagues know that that's the reason why. So at the end of this presentation, the participants should be able to, with accuracy, define what is a profession, professionals, and professionalism, outline 6 areas that professionalism can be applied after a discussion, describe 4 examples in which lack of professionalism can lead to legal implication for small group discussion, and discuss the roles of the nurse in professionalism toward the individual. We'd want to display through an activity how professionalism is measured among students and nurses in the profession, and discuss the importance of professionalism among professionals upon a reflection. So professionalism and professionals. So with professionalism comes responsibility, creativity, sincerity, fairness, and respect. So the first question would be, what is a profession? Can you go back, please? Thank you. All right, before we actually go into what I have, I hope nobody saw that before. Can anyone raise their hand and tell me what they think a profession is? And what makes it different from a regular job? If you're using your phone, you'd have to go into the settings section and click raise hand. Anyone want to try? One of our UE students, you'd like to try to tell me what a profession is and what makes it different from other jobs? Somebody's in the chat speak. Anyone? All right, I'll give you time to warm up. You can go forward, please. This is Marshall Davis, next slide. So a profession is an occupation which requires specialized education, training, and skills that meet a established set of qualification. These skills and training are designed to match the expected performance criteria required for employment. And that's what all of us had to do in order to become nurses, right? And that's what our students are doing in order to join the profession. Miss Danielle Stevens, we are hearing you. All right, apologies. Right, so as I was saying, that is what makes nursing a profession. We are required to go through specialized education. We are required to learn specific skills based on our education, and we are required to meet a set guidelines and qualifications before we are said to be in this particular profession. So we are expected to meet those criteria as laid out by the laws of the land and internationally as well. So usually it's guided by the laws of the land as well as discipline-specific ethics and norms. So other persons are part of other professions, and their professions would have their own specific rules, and they have to abide by that in order to become a profession in that profession. So whether they're nurses, doctors, lawyers, they have to meet certain criteria in order to be welcomed into said profession. And usually because of and usually admitted by their local council. We have the Nursing Council of Jamaica, and for other places they have their legal medical council as well as legal councils, as the case may be. So a professional is an Can you please go back? So a professional is an individual who has met all these qualifications, which is the education, skills, and training required for entrance into a particular profession. So once you have attained the qualifications required, then you will be said to be a professional. However, we're going into know what is professional behavior. So you may have attained the qualifications, you may have attained the skills and attained the training, but what makes you truly a professional? So some of the characteristics of a professional would be the person should be honest, should be skilled, should be courteous, should be reliable, should be considerate, should be dependable, should be cooperative and committed. And when you think about yourself as a person in the job or as a person in training for our nursing students, do we embody some of these characteristics? Do we embody all of these characteristics? Are there things that we need to work on in order to fulfill these characteristics? Because we're not perfect and we may have our off days, but we should always strive to not only be qualified, not only be skilled, but there are some soft skills that we need to in order to interact with not only our colleagues, but also our clients, our patients, our family members, and other members of the healthcare team. So professional you can be termed as a professional, but your behavior is what makes your whole your professional life holistic and whole. Because if you're not behaving in a particular manner, then that would mean that you're not going to be viewed as a professional. You just have something on paper that says you should be a professional. So when you look at this picture, it speaks about the 7 C's of professionalism: compliance, character, comfort, conduct, communication, cognizance, commitment, and completion. A professional, when you're displaying professionalism and trying to be a professional person in the workplace, you will have to comply to some rules and regulations. It might not always be rules or regulations that you are agreeing with or in agreement with, or you may not even live by those rules. However, when you're in those workspaces, this is what is expected. And even if you would voice your displeasure at some rules or discrepancies about what is expected, you are expected to be compliant with the rules of your institution, with the rules set out by the government, because we know that as professionals, this is what keeps us separated from persons who are not as skilled and not as trained. We need to have character. So while we want to be fun, while we want to be pleasant, we also want to be efficient. And anything we're doing should be towards efficiency, meaning whatever we do must be for the good of the client. Whatever we do should be for the good of our profession. Whatever we do should be for the good of our work environment. So because we know that if we're not working together as a team, and I remember I keep saying the healthcare team. So the healthcare team is made up of our nurses, our doctors, our physiotherapists, our psychiatrists, aides, and all those persons. If we're not working together, and we will not be effective. And that comes down to the character of each person. And of course, co-workers must be comfortable, clients must be comfortable. And if both sides are comfortable, then that would mean that the environment will be a comfortable environment and therefore be more efficient. So that's what we're looking for. So when we look at these 7 C's of professionalism, we can see how this will help our work environment. We can see how this will help the health of our clients. And we can see how this will help our work environment for our co-workers to be much more comfortable. Next slide, please. So professionalism, regardless of institution and specific culture that may exist therein, it is important and expected that staff members are able to work well together. And it comes up a lot because our students will know group work is not the best thing in the world, right? Because sometimes, you prefer to do things on your own. But the thought process is that there's so much work to be done on a daily basis for any particular ward or department that we can't do it by ourselves. And therefore, we're working as a part of a team. And regardless of the institution, regardless of the culture, whether it is in Jamaica, outside of Jamaica, any subcultures, it's very important for the well-working of our institution or departments or wards that people find a way to work together. And the professionalism part comes in because We know that everybody has different personalities. We know that people may perceive life differently. But how can we understand each other? How can we work with each other in order to achieve the major goal, which is the priority, which is the care of our clients on a shift, during a month, during a rotation, whichever the case may be? How can we find ways to work together in harmony? We don't have to be friends, but professionalism this dictates that we should work well together. And in order to do that, we have to speak with each other and ensure that we find a way to make the priority the priority. All right, next slide, please. So professionalism in nursing, which is one of our main topics today. Sorry, I'm letting people into the meeting. So this is more than simply wearing a uniform or dressing in a particular manner for work. It is more than speaking politely or appropriately. It incorporates a set of values that are important when elevating the quality of co-worker relations and patient care. It provides methods, standards, and judgments that guide practice. So sometimes when people say you're supposed to be professional, people oversimplify it to mean just what you're supposed to be wearing. And while that is important, how you present yourself is important. It is also important to get along with each other. It's also important to know what your objectives are and how to meet those objectives in a collaborative way with all members of the team. Excuse me 1 second. I'm getting feedback. Apologies. Everyone, just please remember to mute your mics when you come on. Sometimes I know it happens to my device. Sometimes when I join a meeting, it automatically opens the mic. So just check when you join, if you get knocked off, to silence your mics or mute your mics before you when you come on. So professionalism nursing describes required qualities and skills expected to be displayed in the performance of functions. A specific type of behavior and deportment is expected to be displayed while you're in the workplace. Expected behavior ranges from deportment to appropriate and healthy interactions with co-workers or clients. So that's what I'm saying. It's not just, it's a number of things that work together to form you as a person in the workplace. And you realize I'm saying in the workplace because we know you have your lives outside of work. We know you have your lives outside of school for our students because we have our students here as well. But it is important that you know what is expected of you while you're at work, and even sometimes outside of work, because people look to you for advice and for examples when you're outside of work. But we can give and take where that is concerned in some cases. The important part is that we are deporting ourselves in a way that is appropriate when we are at work. So the essential characteristics of a nurse should be empathetic. So you should display empathy. We need to have good communication skills, emotional stability, interpersonal skills, flexibility, and attention to detail. Now, empathy means we're not sympathizing. We're not feeling sorry for our clients. We want to put ourselves in their shoes and think about what they may be experiencing so that we can better help them. But if you're pitying the person, you may not have the mental fortitude to help them. And that's where the emotional stability may come in. And I know a lot of us may not be emotionally stable right now because of all the pandemic and all the things that may be happening right now that may be, chipping away at our emotional health or mental health because of all the restrictions and all the fear and anxiety that comes with having to work with persons who may be infected. But it is very important that if you feel that way, if you feel overwhelmed in any way, it's very important that we try our best to express ourselves. And we want to think that as a professional, our supervisors, our administrators, our persons who are in charge of us will be understanding because they're going through it too. And we must be honest about these things because we know it can impact our patient care. We know it can impact our co-worker relations as well, because if you're not feeling good, sometimes we snap at each other, we snap at people, and it's not that you mean it that way, it's just that you're just so overwhelmed. So it's very important as a nurse, as a mental health professional or a health professional in general, to ensure that your mind is right when you're coming into work, because we know it can impact so many persons in a negative way if we are not emotionally stable. Interpersonal skills, we spoke about that just now. It's very important to get along with or attempt to get along with our coworkers so that we are able to give the clients the care that they may need. And flexibility, we can't only see things as black and white. We must be able to be flexible while not compromising our patient care, because we know that the priority is our patient care, the priority is the well-being of our clients. And if, of course, if we need to be flexible to do that, then we need to find safe ways, ethical ways in order to do that. And attention to detail is important, because sometimes if we're not paying attention, we will miss things that may be detrimental to our clients or the client's family members. And as persons, especially persons in mental health, we know that if we miss even a little thing, it can cause harm or death to family members of clients, because we missed something about our client that may have been dangerous. So, and attention to detail will include listening and always reading, always making yourself aware of what is the current way of dealing with different conditions, because we don't know everything. And knowledge and science is always changing. Remember, nursing is a science and it's based on evidence-based practice. And so we have to ensure that we are paying attention to detail, not leading on our own understanding, but on the evidence that will help us to give the right advice to our client, the right care to our client at all times. So some of the consequences of unprofessional behavior would be disgruntled or frustrated employees, unsatisfied customers or clients or patients, low engagement and morale of staff, and some of us know a lot about that. It may cause a toxic work environment or atmosphere. We also know about that, because if we're not feeling happy, we're not feeling good, and everybody's in conflict, then we will have poor atmosphere and the environment will feel very heavy. You might have a high staff turnover. You might go to a place this month and the next time you come, you don't see the same person, you see other person. And you might wonder, why is it that this place loses staff so often? Maybe the staff are not happy. Maybe the staff are not being fulfilled, and persons who are in positions of leadership need to look at that to find out what is it that is causing this this turnover. Is it something that can be mitigated? Is it something that can be planned for? And if we do that, we may be able to retain more staff. And of course, you might have difficulty recruiting and retaining staff if the environment is known or has a reputation of being toxic. And so we are expected to find these things out. So unprofessionalism can go from the top to the very bottom. And we have to ensure that we are behaving in a professional manner, so that we are not only making our clients happy and safe, but we're making each other happy and safe, which will create a very holistic and therapeutic environment. So additionally, the unprofessional behavior can have a negative impact on daily operation and productivity of the departments and units. It may result in poor client and staff safety, negatively impacts quality of care afforded to clients, and it may negatively impact overall department and institution reputation. So it has a lot of far-reaching implications if we are not behaving in a professional manner. People think of it as something very simple, but it can affect so many aspects of our clinical experience for not only us, but for our clients. So some areas for application of professionalism would be respectfulness, character, which we discussed earlier, a little bit earlier, professional appearance, dedication to the public good, competence, and good communication. And in terms of respectfulness, there are 4 agreements. We must be impeccable with our word. Speak with integrity, say only what you mean, so we're not lying to persons. We need to avoid the word to speak against yourself or to gossip about others, and use the power of your word in the direction of truth and love. Shanice, we are seeing your video of somebody carrying a baton and all these things. Can you close your video, please, if you don't want us to see what you're doing? Thank you. Don't take anything personally. So when we have our disagreements in the workplace, it's very important that we talk about the actual issue and not the person, because whatever we're doing in our workplace should be specific to that. It shouldn't be a case where we are attacking someone personally or themselves. So it's very important that we try to keep things from a person apart from personal level. Nothing we're doing should be because of somebody specific. The others, what others say and do is a projection of their own reality, their own dream. So sometimes we may take on some things, people may not like something about you, and you take it on personally. But sometimes it's not about you. Maybe sometimes the way the persons treat others is because it's about how they feel about themselves. And so maybe we need to have a conversation, because if you notice an issue, because conflict will arise. No matter what we do, people have different personalities which are different. But how do we interact with each other if there's a conflict? How do we resolve the conflict? And that is the part where professionalism comes in. So when you are immune to the opinions and actions of others, you won't be the victim of needless suffering. Because sometimes we torture ourselves, sometimes we torture others by treating them poorly because we are feeling hurt ourselves. And anybody have heard this saying, hurt people hurt people? Because sometimes what persons are projecting is not necessarily the fact that they want to attack you or they're picking on you, but maybe they're just unhappy with themselves at the moment. And we need to help each other, lift each other up if it is possible. And of course, we should never make assumptions. We need to find the courage to ask questions and express what you really want. And as I said earlier, if it's the case that you're noticing something different or a change in someone, or somebody is snapping when they don't usually snap, try to have a conversation. Try to think about, what may be making this change in the person. And it is our hope, by finding some common ground, that person's conflicts will be resolved and the environment can return to being therapeutic. And of course, we try to communicate with each other as clearly as we can to avoid misunderstandings and sadness and drama. All right. And that's why we're going back to number one again. We try not to gossip. We try not to carry news about each other. If we have a problem, we speak to the person. If, of course, you feel like you can't speak to the person, then we may need to find a neutral party in order to help us resolve the problem, which is good as well, which is fine as well. Number 4, always do your best. And it comes back to the integrity, paying attention to detail. Your best is going to change from moment to moment. It will be different when you are healthy as opposed to feeling ill. And under any circumstance, simply do your best and avoid self-judgment, self-abuse, and regret. So it's very important that we are trying to do our best in whatever state we're in. I will say, though, sometimes when we're so disgruntled and we're upset, maybe you need to take a break. You may need to ask for, some time or some days, because we realize you have to have some self-awareness. Realize that, maybe I'm just tired. Maybe I'm emotionally tired. Maybe I'm physically tired, and it's playing out to my clients. It's playing out to my co-workers, and it's creating a toxic workplace environment. And being that self-aware and speaking to those persons who lead you, you hope that they'll be understanding and give you the time that you may need in order to make yourself mentally healthy, and therefore a more professional co-worker and therapeutic agent, because as the nurse is a therapeutic part of the patient's treatment. So respectfulness. So respect for colleagues is an essential part of the workplace professionalism, and there are various ways of communicating and approaching, and varied ways of communicating and approaching issues. Apologies. Be tolerant of different points of view. If you would remember me saying earlier, persons think differently, persons are from different backgrounds, and maybe their perspective on life is different, which makes them see things differently. Be tolerant of that. You may not agree, but you want to understand other perspectives in order for us to get along, in order for us to understand why people do things. And that is important for respectfulness in the workplace. We want to listen and be open to ideas and suggestions of colleagues and supervisors. So realize I say colleagues or supervisors. Sometimes you may have a colleague may not be a supervisor, but the colleague may have some insight on whatever it is that is the problem at this time. So it's important to listen to them, and maybe you can have a discussion, especially if you don't agree, and if we can find an evidence-based way to approach the issue collaboratively, it will make things much easier, much more pleasant, and it may lead to increased quality of care for our clients, because we are merging 2 points of view, we're merging 2 sets of evidence-based practice, and therefore the outcome for the client should be more positive. Actions such as saying please and thank you help build collaborative workplace relationships, and it establishes you as a professional who works well with others. And we spoke a little bit about that earlier. We may not get along in terms of personality, but while we're in the workplace, we can say please, we can say thank you, can say good morning. Pleasantries are always expected, no matter what the situation is. Body language in the workplace. So we have positive and negative body languages. So positive body language, enthusiasm to contribute. So whenever we're having a meeting, whenever we're having a discussion, as a part of the team, we expect you to want to, give your contribution, give your opinions on things based on what you're experiencing. We don't want you to be resistant to contributing, because some persons, I've heard persons say they don't want to contribute because they feel like they're not being heard. And that is a very big problem. And of course, if you feel like you're not being heard, it's very important to speak to the person leading the meeting or the discussion and say, I thought I was trying to say something before, and I feel like persons are not hear what I'm saying or taking into consideration what I'm saying. No, you can't control what other persons do if they don't listen to what you're trying to say, but it is good to voice your opinion.
What happened?
Sorry about that. Have confidence in your abilities. If you're always doubtful in your abilities, then it may come off as being negative. It might cause doubt in your clients and their family members, and that may affect your ability to give advice and to treat our clients. Not to say you're going to know everything. And of course, if you don't know something before you go before your clients or before you speak with your clients, it's important to speak to somebody else who you may think may be a little bit more knowledgeable about the situation before you approach the client, because projecting confidence is very important in the building a rapport with our clients. We need to be comfortable in taking on challenges. Sometimes you may be asked to do something that you may not necessarily be comfortable with at that time. Maybe because you haven't practiced it very much, or maybe it's not your favorite part of the job. But, be known as somebody who takes on challenges. You may not be great at it at first, but you'll be seen as somebody who tries. And that's a part of being a professional, trying new things, trying to take on learning new skills in order to be a better person, a better employee. And that is a big part of professionalism. Be passionate to drive results. So maybe whatever is happening in your department, in your group for the students, in your workplace, maybe, we may notice that there's ways to increase productivity, so to speak. You can give your opinions or ask for a meeting to be called so we can speak about it and find what other persons may see. Because if you seem to have an uncaring attitude, or you seem not to be connected, then that might demotivate your co-workers, that might demotivate you personally, and then now you have a negative outlook on your workplace, and maybe you feel demotivated and cannot give the best of yourself. So it's very important to be passionate. And if you realize that your passion is waning, remember I said sometimes we're just tired, sometimes the workplace is a very stressful area. We need to speak about it and try our best to find some ways to de-stress or get some time off to relax, because we know it can impact upon client care. And we need to be present to recognize future demands, because if we're disconnected from reality to handle future potential, then of course we are doomed, because we're not going to be improving anything in our workplace. And that is a part of going forward and a part of professionalism. Next slide, please. All right. The character of a professional. So this is just a pictorial representation of what we were talking about before. So character traits is having a strong character means having a strong character means making decisions based on a set of core values. There are several examples for positive character traits. You must be ambitious, creative, compassionate, patient, courageous, flexible, honest, humble, be honorable, have some integrity, tell the truth, and mean what you say, loyal, conscientious, persistent, resilient, and disciplined. Next slide, please.
Just a minute, seems as if it's frozen. So I'll get
Okay.
back. Sorry about that.
No problem.
What is that? Could you just ask a few questions in the interim?
No problem. All right. While we address our technical difficulties, anyone has any questions so far? Comments? Don't be shy. Welcome to our nurses and welcome to our students as well. Oh, I forgot to send the link in the chat for the register. So I've just placed the link in the chat for the register. It's a Google form. So just register there for your attendance, please. Please remember to use your full name as you'd like it to appear on the certificate. Please do not share the link with anyone who's not in the session, please. Thank you. And this form can also be used by the students. Is everybody seeing the link? Hello, is everybody seeing the link?
Yes, Nurse Smith, we're seeing the link. Thank you.
Thank you, Ms. Woods. All right, so in the chat. Okay, I got some answers in the chat. Okay, thank you so much, everyone. And let me know if it's opening and you're able to see the form as well, please. So everyone that's here can go ahead and register right now, since we're trying to sort out our technical difficulties. Oh, thank you, Faye. Thank you, Marianne. So that we can have you registered, and hopefully by the end of most persons registering, we will have our technical difficulties sorted out. I can share the screen, if you want. Or did you change anything about the presentation?
Sorry. You could go ahead and share because I don't know if it's my computer. So you can go ahead and share. Well, it's sort. All right. Oh.
No, that one you can speak on.
Yes. Shoshona, Miss Smith, you're hearing me? Miss Smith?
I'm sorry, I was talking with my mic closed. I'm so sorry. Yes, I'm hearing you.
I'm saying you could go ahead and share your screen because I don't know if it's my computer or what it is.
All right. I'm sharing now. You can see?
Okay.
All right, so that you're up now, Mrs. Marshall Davis. Go ahead.
So, good morning again, everyone. And the various areas that Ms. Smith had covered is very, very important. It is like the foundation in professionalism. And we are now looking at the power of appearance. I know everyone likes to look good, and so it is as professional. We need to look the look. We need to be very professional in the way we attire. So next slide. Is everyone hearing me?
You're hearing an echo, so
Yes,
maybe I
yes.
think you're sounding twice. So mute one of the mics that you're is open near you. This is Marshall Davis.
Okay. One minute, please. Yes, all these technologies. You can hear me any better?
Yes, we are. We are. Go
Okay.
ahead.
So the first thing that is most important is setting the tone. This is not necessarily true, but sometimes it works out where there's a first impression is lasting. And so we must set the tone. People do respond to us based on our appearance, and most of us can attest to that. And we know that there are certain things that we must avoid. The tight clothes. It is so obvious most times when those of us who are nurses, when we step out there, the outline of the undergarment is just in person's face. So these are things that we must try to avoid. We need to look neat and clean. We need to keep ourselves well groomed at all times. Change. Next slide. Okay, and this is just a pictorial evidence of how we look as nurses, and we look so professional at this time. Okay, next slide. We should avoid clothes that show a lot of skin. So unless you work on a beach, you should not be showing off excessive cleavage or midriff or the upper thighs. Our armpits are not professional to view. So just our appearance, it is so important. And that is one of the most necessary parts of professionalism. Next slide. Okay, next slide. So our footwear. These days, sometimes when you see persons, the footwear, not taking it personal, but it is very unsightly when we look at the footwear. If it is white, sometimes it is all the color, whatever the color. So we must ensure that everything is in line with our professional appearance. So all these things that are here, they are just not a part of professionalism. Next slide. So your clothing creates an image of you. And I'm sure all of us on this platform like to look lovely. We like, for example, before you step out of your house in the morning, we need to look in the mirror and admire ourselves first. And once we admire ourselves and recognize that we are looking good, then we are ready to step out. Sometimes persons in our own surrounding, with our spouse or our children, we can just ask them, how do I look? Because sometimes we are looking, but we're not seeing what we ought to see. So that also is important to get another view on our appearance. Okay. Do not dress in a provocatively way, because as was said earlier about the legal implication, sometimes we know that from time to time, sexual harassment comes up in the workplace, but we don't want to be the one to trigger that. So we should refrain from using heavily scented perfume, meaning that in these days, you have a lot of persons who have different type of allergy. So you need to smell good, you need to look good, but we also need to remain being professional. So professionalism is like, next slide, is like love. It is made up of constant flow of little bits of proof that testify to devotion and care. And as something was mentioned in Ms. Smith's presentation about paying attention to detail, not only are we the ones who pay attention to detail, but persons who are looking at our image, they are also paying attention to detail. So they are seeing the things that we sometimes, we recognize, but we are not taking it into account. So it is very important. So it is like love. And love, all persons love and all persons like to be loved. Next slide. So the professional competence, and it speaks of the mastery of our theoretical knowledge. So in order to display our professional competence, we need to have that knowledge. And when we have that knowledge, then we are able to display. We need to have the capacity to solve problems. Some persons that just keep shifting problem from place to place. It's like doing a game where you sending it around. That is not part of professional competence. Commitment to continuous learning. Yes, that is very, very important. And what we find sometimes, in order to be registered, we need to have hours. But what happens most times, and this brings out our dishonesty as well, or dishonesty. We will log into a platform and we're all over the place. So there is no continuous learning, although the platform is prepared for us to learn. We have the ability to create knowledge as well as possess it. All of us have innate in us that ability, as was mentioned earlier in the presentation. It is within us. It's just to use the right means to bring it out. We look at the Kappa's we look at the enthusiasm and commitment to customers. Just recently, I think there's this series of a play on the television, TVJ, that speak about water thicker than blood. And just last night I was looking at it. And one of the person who is supposed to be the customer service person was the first person who the person see when they enter the establishment. She was on her phone and telling the people that they're calling too early, and if they don't know that people need to have their breakfast and all of these things. No, this is a no-no for us as professionals. So therefore, our customers, we must have that enthusiasm. When they see us, they want to talk to us, they want to listen to us. So it is very important. And not only do we have the ability to create knowledge and possess it, but we also need to apply the theoretical knowledge to practice. And that embodied the whole matter of professional competencies. Next slide. So communication, we can't overemphasize communication. It is so very important. It is expected and appropriate to seek for clarification. Many times things come to us, there's nothing wrong. Whatever level you are in nursing, you can get clarification, because sometimes these are what poses problem. So clarification is very necessary, and conflicts can be a result of miscommunication. And we have seen it, as Ms. Smith spoke about the environment, how caustic it can be. It is not necessary if we try to get these things sorted out. And we need to keep personal information confidential. I know sometimes it's very difficult to hold on to something. You must tell your best friend, but we need to check. Do I need to pass this on? I am a professional. This is within the professional setting. Do I need to say to someone else? Okay. When at work, personal phone calls and emails, these are the things that we need to be very careful when we cannot be over the client and we're talking to someone, and also even that brings in our telephone etiquette, where we need to step aside, say excuse if it is if it is an emergency. We need to give our co-worker our undivided attention during interaction. So whether it be our co-workers or our customers, because our co-workers are our internal customers. So we need, whenever we are dealing with persons, in this age of the technology, you find that persons are tweeting away, texting away. Yes, it may be applicable to your job that you are doing, but we are to also ensure that whatever, it doesn't read something different from what is happening. So this is why it is very important to know when to do these texting. That is very important. Next slide. So communication, you notice that communication, it is the gel in the professionalism. So the email etiquette, as I mentioned before, is very important. Official professional communication is increasingly being conducted using emails. And we also know that, so we have to be careful when the language that we use in the emails. Social media is fun, but should be used in limited capacities when in uniform. So we have to be very, very careful what we post while we are on duty or while we are in uniform. So, and one of the point here, never expose clients' personal confidential information. It is not needed on the social media platform. Next slide. So just some gems, and it speaks to communicate effectively, actively listen. Many of us listen here, but are we listening? We need to prioritize effectively, and it speaks to it is important to be prepared to put in the time and efforts to get things done, but also manage to have that equilibrium. We need to create a reasonable work-life balance. It cannot be, and sometimes it happens to us. We are on the job for 16 hours most time as professionals, and especially now with the increase in the corona cases, we are on the job, and you hardly find any time in between, but we must find time for self-care. So there must be that reasonable balance, that equilibrium for us, so that we also can be at our best, accountable to take responsibilities for what they do and say and for what they leave undone. So we need to, in nursing and in most other professional organizations, there's an handover session. So we need to hand over. All right, we need to meet deadline, because all of these are part of the whole professional image. Next slide. So as we continue with the gems, a good role model for others, including behavior, attitude, and relationship. So we need to be good with people. Good timekeeping, which came up, always in before time. And I must commend most of you were on the platform before we actually started, and we apologize again for the lateness. We almost must use our time well, and we must dress appropriately for the role. So when you're at home in your garden, that's a different dressing than when you are, different dress code than when you have to step out there and be in your uniform. So we're going to be knowledgeable about the job. We're going to know our patient, institution, and organization. We're going to speak in a way which is appropriate to each different audience without being patronizing or putting down persons. So we have different persons, different in our scope or in our interaction with our clients. Some are from different level of academic, and therefore we don't need to speak down to persons. We need to help them to come up. And so it is very important, and it is one of the gems. Next slide. So when we measure professionalism in students, Students' evaluation involves reliability, honesty, and confidentiality. It also looks at respecting others and putting the needs of patients first. It has the evidence of cheating and abusing or harassing other students. So we must ensure that whatever we do as students, because students are going to eventually evolve as professional nurses. There must be willingness to follow directives and seek help when recognizing that a patient's need exceeds a patient's capability. And this is not just for students. Wherever we are only human, and from time to time, there is even in research, it speaks about the measure of error, 5% or so. Every research speaks to that. So as human, we know that from time to time, there can be that level where error can come in. So we have to be very careful, and as it relates to directive, clarify, because sometimes we think we hear what we say, and if it is written, we need to look again to ensure that what is given, that is what we follow. Next slide. Professionalism is a quality that is measured by indirect means, such as through observable behavior. So we are always in the limelight. Not only when we are on the social media, we are always in the limelight. Accountability is so important, and that is part of the issue, not just in nursing, but generally, the level of accountability. In recent time, with what is happening in our little Jamaica here as it relates to the church, this is what persons are looking at, accountability. So from time to time, we're in the public space where they say nurse this, nurse that, they are professional, do this, or professional, do that. So accountability is most important. And the first level of accountability is for us to hold ourselves accountable. When we hold ourselves accountable, then we are able to hold other persons accountable. Excellence. This chapter that we have, the Omega Kappa, a chapter of the International Sigma Theta Tau Honor Society, Nursing Honor Society, it speaks to excellence. And even us being here, we are just sharing because we want each and every one of us to be excellent professional. We need to display excellence in whatever we do. Consistently develop through ongoing learning, that comes up again. So learning, and it is said that we don't stop learning until we die. So the day our breath leaves us, that's the time we stop learning. So we are always learning, but we're not only, as the Bible says, ever learning and not coming to the knowledge of the truth. We are learning, and we are going to come to that knowledge of truth and display that knowledge of truth as we learn. So duty, honor, you have integrity and respect for others. This is something that you notice it is coming up in all these slides. Next slide, please. So professionalism is judged against a set of expectations or standard, and that was spoken to in the first part of the presentation. As in order to become a professional nurse, in order to even enter School of Nursing or university, we have to have some level of standard. We have to have the qualification. And so we are guided by certain standards. From our own personal values set and understanding of what professionalism means. So we must have a standard set for ourselves, because sometimes that is where the issue is. We don't have a set standard, and so anything will do. It may be situational in nature, so it can, just like with leadership, persons will emerge leaders. So this judging of professionalism, depending on the situation, we can rise to excellence in whatever situation comes our way. It is also strongly influenced by culture, and we know that, because if you go to another country, you'll find that yes, the basic, because based on the International Council of Nursing and the National Nursing Association, culture do have a part to play in us as professionals. Next slide. So, as we have here, we have a table to show how, or a comparison as reflection. So you have for professionalism and the manifestation, how it works. So you have the trait, you have tactical aspect of professionalism, we have self-awareness, we have awareness of others, and this is the context. And we have trustworthiness, ability to relate to the context. We have the overt aspect of professionalism. We have the vocational section. We have the altruism. So not only as something came up earlier about not being empathetic and not sympathizing. Okay, we have the responsibility, and last but not least, we have accountability. And you notice accountability is very, very important. Next slide, please. And that is the end. Thank you for listening. And it is time for you to express and have your questions, whether in the chat or you may open your mic and answer. Back over to you, Shoshona. Thank you.
Thank you. Thank you, Mrs. Marshall Davis. And what Mrs. Marshall Davis did not say, and she does not advertise it, she was the director of nursing services at Spanish Town Hospital. So she has a wealth of knowledge when it comes to professionalism and supervising persons. And I must say, working with Mrs. Marshall Davis, she embodies a lot of all of that she spoke about just now, because she even though she has so much experience, and even though she was a director of nursing services, she's not afraid to ask questions, not afraid to learn new things. And we work together in order to create this presentation. And it's much easier to follow something when you're around somebody who embodies everything that they're talking about. And she really and truly does that. So I'd like to say thank you, Mrs. Marshall Davis, for giving us a bit of your wealth of knowledge. I was like, why can't I see myself? And I just realized that I had something covering the video. All right.
Thank you very much.
You're welcome. You're welcome. Any questions, everyone? If there are no questions, and I've seen any raised hands, Mrs. Marshall Davis would also like to give an overview of what Omega Kappa is about. And you will notice in the register, let me put the register again for those persons who may have missed it. I put it in the chat again. The register asks if you're interested in joining, because if you're interested in joining, then of course, we will contact you afterwards. Mrs. Marshall Davis?
So I will just share the presentation. Yes, so thank you again for sticking it out with us. I still see we have an audience of 72 persons. Thank you very much, each and every one. What I would really like to hear what some of you have to say. But before so, let us just look at what is this Omega Kappa chapter. And as it says, it is a global nurse. It speaks to global nursing, and that excellence is very
Davis.
Yes.
You need to skip which slide. We're still seeing the title slide.
Pardon me?
We're still seeing your title slide.
The title.
So,
okay.
As in the first slide. Mm-hmm.
Okay. So please, you need to assist me. I'm not ashamed to say, because.
Just click on it, it should change. Go ahead, yes.
Okay. Oh, I was just talking before I get here. Okay, thank you for that. Yes, so as I said, what is Sigma? What is Omega Kappa? So in 1922, 6 nursing students founded Sigma Theta Tau, International Honor Society of Nursing. And you hear what it says? 6 nursing students. Okay. Today, it is known as Sigma at the Indiana University Training School for Nurses, which is now the Indiana University School of Nursing in Indianapolis, Indiana, USA. The founders chose the name from the Greek words storage, thoros, and time, meaning love, courage, and honor. Sigma is a non-profit organization which the headquarters is in the United States. The vision for Sigma: connected, empowered nurse leaders transforming global health care. And the mission: developing nurse leaders anywhere to improve healthcare everywhere. And each person on the platform, you are a leader. So potential members who meet their eligibility criteria are invited to join Sigma, whether as a baccalaureate and graduate nursing students who demonstrate excellence in scholarship and nurse leaders exhibiting exceptional achievements in nursing. So here are some additional facts about our membership. Sigma has more than 135,000 active members. That's nurse leaders and nursing students. Approximately 540 active chapters in more than 100 countries. Undergraduate nursing students must be enrolled in a bachelor's nursing program or equivalent. They should achieve academic excellence based on set criteria, be ranked in the highest 35% of their nursing class, have completed 1/2 of the nursing curriculum. RN to BSN students must have completed 12 credit hours. For the graduate nursing student, they should have completed 1/4 of the nursing curriculum, achieve academic excellence based on set criteria, and meet the expectation of academic integrity. Be legally recognized to practice in their country, have a minimum of a baccalaureate degree or the equivalent in any field, and they must demonstrate achievement in nursing. How do I join? Let's hear it. Okay, so these are the benefits. Career mentorship, access. So when persons may say, what will I gain from being a part of this, the Sigma, and by extension, the Omega Kappa chapter? So there are, and I'm telling you, persons from university and across other universities in Jamaica, they have had some of these benefits. So you have access to nursing professional development courses, access to the e-repository of research and presentations, access to writing academies, opportunity to publish, opportunity to access grants, which is research grant, opportunity to network, opportunity to volunteer, nursing webinars and conferences. So these are some of the benefits that are offered to us as members of this noble society. So there are, so chapter 560, that is our chapter Omega Kappa, is based at the University School of Nursing, Mona in Jamaica, multi-country chapter, Jamaica, Trinidad and Tobago, the Bahamas, the USA, England. So all these persons are part of our chapter. And we were chartered on May the 30th, 2019. Nurse leaders and nursing students are part of it. And these are some of the Omega Kappa facts. And this was when we became a chapter. And if you look good, you'll see some of us here who you know. And this was when we went to the convention in 2019 in Washington, DC. And there, I'm not seeing Shoshona, but if you look behind the flag, I am in the middle there. And these are other persons. We have different activities like beach cleanup. And as you see, these are some students who are members. And see our president, Madam Cheryl Garrix Lloyd. And these are things that we have achieved while being a part of this chapter. And all this that you are seeing, it is what had happened. We have our health fair, and when we had the nursing now, we were there as well. And this was one of our induction online virtual induction ceremony, and this is the number of persons that were inducted and other members. And that is it for this morning. Thank you very much for being there. Okay, Shashona?
Yes, I am here.
Okay. So never forget the light you bring, the difference you make, and the lives you change. And that is all that we are doing now. Thank you very much.
Okay, thank you, Mrs. Marshall Davis. Thank you so much. So Sigma, a lot of persons have told me they heard about Sigma, they don't know what is that we're about, and that presentation that Mrs. Marshall Davis just showed was a nice and very succinct way of showing what we do as a chapter, and there's so much more to come, and we welcome new ideas and new members at all times. Another thing that persons may not, I don't think you said it, Mrs. Marshall Davis, there is a fee that has to be paid to Sigma International, is not to us, for membership, and that's what opens a lot of the benefits that we may get from the international side, such as, you know, continuing education hours. We may have access to webinars and wider knowledge. You get to interact and network with persons from different nationalities in nursing, and it's very eye-opening to see how other persons do things in other dispensations or in other jurisdictions. So Sigma is a really wonderful thing to be a part of, and that's why I was saying, as you will notice in the form, it asks you if you're interested, and if you're interested, we will be contacting you with additional information that you would need to send to us for consideration. Sigma is about nursing excellence, and nursing excellence is not only academic, but in professionalism and your professional behavior. And so we invite persons, as well as once we are invited, our governance committee would have to meet in order to discuss your application with the documents you would have to send to us, which you would tell you what those are once you indicate your interest. So thank you so much again for your part, for being here. Any questions, any comments, anything you want clarified based on the presentations that were presented? I'm hoping that this means that everything was very clear. Thank you so much, Bailey. All right, so you don't have to open your mic, you know, if you don't want to speak. You can send your questions in the chat. We're open to any questions. Oh, thank you. Thank you, Miss Marianne Galloway. Thank you. Marine Galloway, sorry. All right, once again, I'd like to welcome and thank our Bellevue, I would say massive, our Bellevue Massive, for coming and being a part of it. I see a number of names that I recognize. So thank you so much for coming and being a part of our presentation. I'm hoping that please do not leave without registering that you are here using the link. I'm hoping everyone has seen the link. If I need to send it again, let me know. I've sent it like 4 times already, but if I need me to send it again so it's easier to find, let me know. That's how we'll know who was here, so we can create your certificates. We have asked for persons. Oh, I'm so sorry to hear that, Marika. Right. So we have asked the Nursing Council to grant us continuing education hours, and the only way we'll be able to give everyone their just time will be through the form. So we'll have to see the names. Thank you, Sister Cameron. Okay. All right. So I'm hoping that when I check, I'll see 75. I think the highest number we had was around 80 persons who have registered, so I can get to work creating these certificates. Thank you, everyone. Thank you so much. It would be 10, 11. So we're going to ask for 1.5 or 2 hours continuing education hours. All right. Is there anything else, Mrs. Marshall Davis, or is that it? Thank you so much to our nursing students. The students doing NURS 3137, they are here and listening and being a part. I would have hoped for some more participation, asking questions. So not only myself or Sister Marshall Davis can answer you, there are other very knowledgeable persons here. I think I see the Deputy Director of Nursing Services for Bellevue here, Mr. Davis. Hello, Mr. Davis. I'm seeing Sister Gordon, Sister Michael Grant, and lots of knowledgeable and experienced persons are here that could answer your questions should you have them. And I'm asking all our nurses that are at BVH, please look out for our students and give them as much assistance as they may need. And of course, you can contact Mrs. Garrix Lloyd or myself should you have any questions regarding those students, because we are open to suggestions and we are open to your questions, which will make their experience much better. Oh, thank you, Claudine Brown. I'm happy persons are saying they enjoy the presentations. I'm happy persons got something from the presentation. Oh, I did not see. And another a past student of Bellevue, Miss Renee Brooks is here as well. She can tell you about some professions that are not necessarily in the hospital, but she's still a nurse and she's doing very well. So we have a lot of knowledgeable people here in our company. Who's on? Persons are just. Go ahead.
And if I must say something, Shoshona, I'm just letting the team know that the opportunities are great. Another convention is coming up between the 6th to the 10th of November, and members from the Omega Kappa will be there, including myself. And you as well, Shoshona?
Yes, I am. Yes, I will.
Right. So there are many opportunities. And I see Nurse McNabb, one of our infection control nurse who lives abroad. She's on the platform. Thank you for attending, Nurse McNabb. Really happy to see you.
Yay.
You're most welcome. Right.
Because I'm searching for my children, you know. I'm searching.
Great presentation, Matron. Great presentation.
Thank you very much. Thank you, everyone. Thank you so much. It was really, to think that we had over 70 persons on the platform, it's really is a blessing. And I'm happy to be in touch with
you see that, Natalie?
You know, it is a good time.
Okay.
Thank you so much.
Okay, Natalie says, Natalie Smith, I'm thinking that's one of our students, said that she sees from the presentations areas she can utilize in being a consummate professional. And I'm so thankful for that. I'm hoping that's not only one person that's getting that, that's a number of persons or everybody getting that from the presentation, because that was the aim of the presentation. So thank you so much. The person who is sending their email, Shelly Ann Brown, please see the link for registration, and that's where you put your email, okay? And we would get back to you in terms of sending you your certificates, as well as contacting you if you are interested in joining Omega Kappa.
And I must say as well that it has been a joy and a pleasure working with Shoshona. She's my new adoption. And you know, I'm really happy. And I've adopted Nurse McNabb, I've adopted so many other children since I left Spanish Town. But you know, I see Rochelle Wright. I think I know her. But it's nice to have you all participating this morning. Take the time out to be here.
Thank you so much, Mrs. Marshall Davis. Marika, we'll be using this presentation as a part of our drive to, and we're going to be creating other presentations, but as a part of our drive to, as a Omega Kappa series. So we'll be using it in multiple places. So we wouldn't be able to send you these presentations. But if you'd like us to come to or present in this way virtually to your organization, we are more than happy to do so as a part of our outreach to and as our contribution to our nursing fraternity in Jamaica, and even further because we have persons joining from abroad as well. So let us know. Bailey, yes, you will be able to, but some of these are aimed at income generation for our chapter. So don't be surprised if you are asked to pay for some of them, but these different topics are, some of them will be like this, which will be free. And please let us know any other topics you'd want us to create presentations for.
Yes.
So we will get that together, and we will just like this invite other persons, and even when it is a little bit more safe, or when we are able, we can go out into different places to do the presentation as well. So if you have any topics that you want to suggest for Lee and other students, please do. Let me send the link again, Sister Gordon. Okay, Marika, so please let us know where you'd like us to be, and we'll try to find a time so that we can be there to do this presentation again, because if you need it, we're there. I just sent the link again, so you can try to join. Wallfall is one of our students, right? Mm-hmm. Oh, Mandeville. So, because it's Mandeville, that would have to be virtual, because we may not be able to drive all the way down there. But, if you're putting us up, we'll come. Wallfall is saying that she's really thankful for the points, Professionalism, because we're all socialized differently, and resocialization is essential to prevent broad brushing with negative narrative we experience ever so often. Yes.
Thank you so much for
true.
that.
Yes, that is so true. And we're not asking you to throw away what you would have learned if it's something positive. If it's something you're bringing to the table that will positively impact your work environment, positively impact your patient care, then we're all for it. But it's important to speak up and have a genuine, calm, appropriate conversation with those persons with those things that you may not be agreeing with or may not understand, in order to get to the point where we're using your knowledge or your perspective in order to improve patient care and work environment dynamics.
And what I must say to learning is ever ongoing, because even as we go through the presentation, and as I hear Shoshona did her part, I am learning something new. So it cannot be dusty or overused. So professionalism is most important.
Just like, once again, people saying that they need it's continuing education hours, CME is medical hours, unless this person is a doctor, in which case, sure. We didn't ask for permission from the medical council, so I'm not certain that you'll be getting any hours from this if you're a doctor. But if you're not a doctor, it will be continuing education hours, which is CE hours. And in order to do that, you would have to please register. Don't send the email here. Please register using the link, which I'm sending again. Please use the link, and then we will know who was here so that we were able to send you your certificate. Thank you. Yes, Fairly, I recognize the name. All right, so how do you reach us? You can email. I might join a blank right now. You can email me.
Mine is easy. I can put my email as well.
Yes, please. Yes.
Okay.
I'm trying to remember the Omega Kappa email address. I'm
I
getting
remember.
I'm getting so old. I can't remember things anymore.
When they send it to me, I can forward it.
Okay. Let me see. I was just in there this morning. Omega.kappa.chapter.
Okay, okay.
Omega.kappa.chapter
You
560.
find it?
Mm-hmm. Omega, it's not Omega. Omega dot chap Omega dot kappa dot chapter. I can not spell chapter 560 email. All right, so I'm sending our Omega Kappa email address. Please put your in the subject area that you would like, what you would like, and of course in the email what you would like us to do, and we will definitely get back to you on that. Anyone else have any questions? And I'm still taking suggestions as to other topics you would like to. Oh, hello, Nurse Pelisi. Hope I did not butcher your name just now. Thank you. She's from the St. Joseph Hospital.
Okay.
Right. So
Very
please,
good. Welcome.
yes, please send us suggestions as to topics that you may want us to do, so, like these, and we will definitely get towards creating these presentations so that you're able to we're able to create more of these sessions. That's the aim. You're welcome. Alrighty, I think that's it, Mrs. Marshall Davis.
Yes, it is. Thanks
All right.
again.
Yeah, thank you. And thanks everyone for being a part of it. Let me write that down. Where's my book? Mrs. Marshall Davis, can you write that
Oh,
down?
yes, I have something for workplace.
All right, workplace conflict. Right. That's a very good one. And as we had spoken about earlier, it is unavoidable to have disagreements in the workplace, but how do we deal with it? That's great. Natalie says overcoming COVID in the oh Lord. That's another topic, Mrs. Marshall Davis. I'm not sure how we would overcoming COVID itself or COVID fatigue, because COVID itself, it's much bigger than us. But we can look into that and see what we can come up with.
It's just, yeah, that's a very good topic because too much persons are, so once we follow the protocols and so on, but we can come up with something.
That's a good one, Fairly. Transitioning to the nursing profession. And that's for graduating students or graduate students, as in first year or persons on orientation. That can help as well. Thank you so much, Fairly. That's good. Natalie, you have to give us something more than fear. Are you adding to the first one? So it's the fear of COVID in the clinical setting. Is that what you want to say, Natalie? Natalie. So Mrs. Marshall Davis, Natalie was saying she wanted
Miss, I opening my mic.
Yes, go ahead.
Yes, Miss. I was saying overcoming COVID in terms of the fear with several of our nurses dying from it. So we may have things to empower us, like in order to overcome those challenges, things that we can utilize, avenues that we can access in order to mentally fortify ourselves and also to equip ourselves in order to provide the care for patients that are COVID positive.
Completely understanding. Thank you so much. That's a great.
Very,
yes.
And it's very necessary at this time because the fear is real.
Yes. And it can be not only COVID, but any other pandemic, because this will not be the only pandemic we'll face in our lifetime. Hopefully it's just the worst one and we'll get over it. But the fear of something of this nature is very important to talk about, not only for students, but anybody who has to work in such a high concentrated area of illness, because we are more vulnerable. But even when vaccinated, because we are basically in the pot of the most concentrated. So where other person may only be exposed to maybe 5 or 10 persons on a daily basis, you're exposed to many more on a daily basis, and so that increases your probability of getting sick, and that is fearful, because you can take it to your family member. So thank you so much for that topic. We will definitely think about that. Balancing work and life, that's the consummate problem for a nurse, right? Or any medical professional or healthcare professional. Yes. Khadijah is saying Mrs. Whitaker. Who is Mrs. Whitaker?
I guess it's a previous.
Oh, Bailey. Sorry, Bailey. Sorry. I forgot your new name, Bailey. I'm so sorry. All right. You got all the topics, Mrs. Marshall Davis. I don't want to miss any.
I have 5 so far. Let me
5.
reiterate: workplace conflict, overcoming COVID in the clinical areas.
Overcoming fear of COVID. She made an adjustment.
Okay. Oh, so that's the same one. Okay. Overcoming fear. Okay.
And balancing work and life.
Work and life. And transiting to nursing, to the nursing profession.
Yeah, transitioning to the nursing profession for the graduate.
So that is 4 so far. Yes.
All right.
These are good topics. Thank you so much.
So great.
And I must say, I don't know if anybody is on for Spanish Town, but I have an invitation from the in-service person that we need to arrange for Spanish Town.
Ah, wow. Okay, so we're going Mandeville, we're going to Spanish Town.
Yes.
Awesome. No problem. All right, peoples. Mrs. Marshall Davis, I think we'd have to give them 2 hours, because we're closer to 12 than 11:30.
Yes.
So that we're going to apply for 2 hours. All right. So thank you so much, everyone. We're going to end the meeting now. I'm gonna stop sharing. Stop streaming. Sorry.